Hi, everyone. Thank you for joining our virtual poster presentation at the National Council for Science and the Environment Conference. This poster is about considering hazardous ecosystems in early care and education programs and policy. My name is Hester Paul. I'm the National Director of our Eco-Healthy Childcare Program at Children's Environmental Health Network. We know that children across the nation are spending many of their waking hours, 35 hours or more, in childcare facilities per day. And so it's very important to think about what potential exposures there may be to toxic chemicals. With this project work, the Agency for Toxic Substances and Disease Registry has provided funding to state health departments so that they can create initiatives or programs to make sure that the siting or the location of childcare facilities is safe for children. And so the 4 areas that we're thinking about through the auspice of this program is the past use of a site. So what was it formerly potentially used for? What are current or neighboring industries that are nearby a childcare facility? What are naturally occurring contaminants in the area, and also what's going on near or with the drinking water. The partners that have come together for this work are the National Association for the City and County Health Officials, Children's Environmental Health Network, and the Environmental Law Institute. Next slide. So again, we are in year 4 of this funding. The first 3 years, there were 25 states that received funding from ATSDR, and now in this 4th year, we're up to 25 different states. Next slide. There are a plethora of resources that have been created with this funding. They're all provided here with hyperlinks. The very last resource is the general guidance that was created by ATSDR, which is the basis of all of this work, helping different state health departments and other national leaders understand how best to go about understanding whether or not there are chemicals nearby that would be of concern for children's exposure. And otherwise, the Environmental Law Institute has created 3 reports over the last 3 years, and they are listed here in this list, having to do with the funding for different programs, having to do with dry cleaners and close proximity, and then also thinking about different state policy strategies for tackling this work. Next slide. So part of this work, then NACCHO actually did some small group discussions and brought together different health departments to think about what were the most pressing environmental health concerns for early care and education centers, and the key findings are here on the right-hand side of your screen. Next slide. On this slide, we're taking a closer look at just 2 states of the 28 state health departments that have received funding. These are different examples for how they have decided within their state to tackle this safe siting work. Ohio has created a video that they offer on their website talking about different strategies and initiatives they have around their Choose Safe Places or Safe Siting program. And Florida tackled it by really breaking their work down into 4 different phases. So instead of realizing that they couldn't do it all at once, they broke it into phase 1, 2, 3, and 4. And here you can see their strategies. Next slide, please. So next steps for this programmatic work is to continue to support these health departments and understanding key partnerships within their states for early care and education professionals. And that might be at the child care licensing level. It might be through different child care resource and referral agencies or networks, or it might be through non-mandated quality rating improvement systems. Ultimately, we 3 partners, the Environmental Law Institute, NACCHO, and Children's Environmental Health Network, look forward to continuing to support these state health departments and meet them wherever they're at to create new strategies and engagement tools for child care professionals.